TMCx is helping us to become a better business, and they're doing that by giving us the language to communicate with CFOs and with other business personnel. There's one thing about starting a business, and that is, I know that there are a number of books out there that tell you how to do it, but until you've done it, you don't really know. And what TMCx has done for us is they've put us in contact with people who have done it. They've made those connections with people who are honest enough to tell us, hey, you're doing this wrong and you might want to rethink it. But they go beyond just saying you're doing it wrong. They tell you how to fix the problem. So I had to literally restrain myself to try to not do cartwheels up here to that song. If there are any like Trekkies out there, then you know that that comes from Star Trek Voyager, okay? So I had to control myself. But today I'm going to talk to you about Voyager Biomedical instead. So do you remember the last time you went to the doctor to have your blood drawn, and the nurse had you make a fist to pump up your vein and then the big stick, right? So for you and I, this probably happens once a year during our annual exam. But for over 500,000 Americans who are on dialysis, they experience the big stick at least 6 times each week or 312 times each year, and that's if the nurse hits the vein on the first try. But what if she misses? She tries again and she misses. A third time, the nurse misses your vein. So those 312 sticks just turned into over 936 sticks, and that's for one patient. When you expand this number out to the over 660,000 patients here in the US, that number becomes between 205 million and over 600 million sticks. But this does not have to happen. Before a patient can receive dialysis, a fistula must first be created in which an artery is attached to the vein, causing the vein to dilate. This makes it large enough to receive the 15-gauge needles that are used for dialysis treatment that are significantly larger than the ones used to draw our blood. Now, 2 of these needles are actually required for treatment. And there are several common problems associated with venous access, such as the vein's inability to dilate or achieve adequate flow. The vein could be too small or too deep in the arm to be accessed, or the poor punctures that can lead to devastating blood loss in the arm and ultimately the loss of a patient's lifeline. At Voyager Biomedical, we have developed an innovative device known as the ARC. Its porous titanium design actually promotes the ingrowth of tissue, causing the arc to scar to the person's vein and become a part of the person's arm. In doing so, it's acting like an exoskeleton, strengthening that person's vein. It would be implanted by a vascular surgeon, so first an incision would be made, and then the bottom half would be implanted, followed by the top half. The incision would be closed, and the patient would be ready to receive dialysis. So I've just shown you an animation of what it looks like for the ARC to be utilized, and I want to prepare you for the next slide. This is the arm of a patient who has experienced the loss of their lifeline due to those excessive punctures and those poor punctures. But again, this is preventable. Our biggest competitor out there right now is the V-wing. However, the V-wing only serves as a needle guide. It does not address several common problems that are associated with venous access. 2 V-wings are actually required, which makes it more expensive than the ARC. However, the V-wing has paved the way for the ARC to pursue FDA 510(k) clearance, making it quicker for us to get to market. The ARC means so many things to so many people. To surgeons, it means fewer repeat surgeries, and they don't have to go looking for additional access sites. To nurses, it decreases the stress that's actually associated with those missed punctures because they don't like to miss the vein in as much as the patient doesn't like to have their vein missed. To hospitals and dialysis clinics, it means a more favorable reimbursement from Medicare. And for the patient, it actually improves the standard of care across the board. So for example, a dialysis patient here in Texas can go to New York and know that the nurse is going to hit their vein on the first try because they have the ARC, and it's easily palpable just beneath the surface of the skin. The ARC is your one-stick, no-miss device that's capable of taking a failed fistula and turning it into a successful fistula. Now, the dialysis population is actually growing at 4 to 6% each year. Here in the US, there are about 660,000 dialysis patients, which equates to a total addressable market of about $660 million. Globally, we would target patients in Germany and in Japan because they have government programs that actually cover the cost of dialysis treatment, which is similar to Medicare here in the US. And there's about 1.2 million patients in those countries. That equates to a total addressable market of about $1.2 billion. At Voyager, we sell the ARC to hospitals. And so at a one-off cost of goods of about $150, at a selling price of around $1,000, there's an existing CPT code for fistula revision for around $2,850, which means that the hospitals and the company make money, while the company maintains somewhere between 80 to 90% profit margins. Now, the team that has come together to bring the ARC to market consists of Dr. Alan Glowcheski, who's here in the audience with us today. Dr. Glow has over 20 years of experience as an interventional radiologist. He saw the needs of the patients, and he is the brainchild behind the ARC. Dr. Billy Cohn has agreed to come on as an advisory board member because he recognized the innovation of the ARC, and he also recognized the synergies that exist between our company, Voyager, and his company, Tiva. And my name is Dr. April Lovelady. I am Voyager's Chief Technology Officer, and I have a background in designing control systems for NASA's Advanced Life Support Systems. To date, we have raised $150,000, which covers the cost of our pilot animal studies, prototype design, and costs associated with filing our utility and PCT patents. We are raising a $1.1 million seed round to cover the cost of chronic animal studies and for the development of our FDA 510(k) strategy. We're also expanding our advisory board members with experienced, talented individuals who can help us clear the pathway to the first-in-human trials and ultimately the completion of our clinical trials and get to market. But in addition, what all this means is that we're building a strong, sustainable, profitable business that will eliminate several pain points for venous access for those who are not only the clinicians but also the patients. So ladies and gentlemen, I present to you the ARC, your one-stick, no-miss device to better vascular access. Thank you.